Good morning. My name is Joan Llovera. The core team in this project is another medical doctor, a nurse, and a sociologist. And we work in a project about hotel housekeeper, hotel room cleaners, about the working condition and health. It's a mixed method study that I present, and is very well known. The tourism is increasing very fast. There are more than 1,500 million tourists per year, in the world, and that's represent 10% of gross domestic product, or 10% of employments in the world. It's an important sector. And the main workforce in this sector, perhaps, is the hotel housekeepers. This is a very highly feminized work field, involving different and repetitive and very demanding physical tasks, and with high strain, and is a job poorly paid, and is an important sector. In Spain, is the second touristic destination in the world after France, and 3 or 4 years ago, there is a widespread social movement, very, very profound, with very profound impact in politics and in medias about the working condition of these kinds of workers. Balearic Island, I am from Balearic Island, as a very well-known touristic destination. In this case, is the main industry. 45% of GDP, it depends on the tourism. We receive more than 15 million tourists per year. There is 200,000 employees in tourism, and 400,000 beds, and there is around 16,000 hotel housekeepers working every season in Balearic Island. The Balearic Islands have only 1.2 million inhabitants. There is 700 GPs working in 58 primary care centers, and on average, every GP in her list have around 20 hotel housekeepers, and in every primary care center, have this 200 or more housekeeper in the list of the doctors of the center, And for that, we thought primary care is a case sitting to promote and prevent health problems for this woman, and we can do a program in this sense, and health promotion with this kind of workers. The project has 3 objectives. The first one is to generate knowledge about the health problem of the hotel housekeepers, and the consequences of the work in this sector. In the second hand, we tend to evaluate the effectiveness of a complex intervention based in health promotion, and in health promotion with a program that we will do, And in the third is to disseminate the knowledge that we created, and to disseminate the intervention for the other professionals and the society. It's curious because this project is founded by the tourist tax. Every tourist pay a little bit of this project in everyday visit of the Balearic Islands. And we have only 3 years to answer these questions and to achieve these objectives. We base in the Medical Research Council framework. The to design and to evaluate, for a design and evaluate the complex interventions, and we follow the phases of this proposal. No? The first one is theoretical part, the second one modeling and exploratory trial, and at the end a clinical trial with this in the phase 3 to do the clinical trial, and we have only 3 years to do that. No? The first at all, we start with a systematic review on the bibliography, and it's surprising. There's a very vast in the world people working in that. It's surprising that a few papers in peer-reviewed publications. We do a systematic review about this subject, and there is a lot of gray bibliography about performed by institutes of health, of working health, and about ergonomics, but there is not a lot of articles in this sense. But it's clear in all of the bibliography, in many countries, is a precarious working condition. No? And this is a group very vulnerable. No? Is especially most of the bibliography is from United States, and is very, very surprising, this perception. No? This is important morbidity, especially musculoskeletal and chronic pain, and the poor quality of life and problem with the psychological well-being. And I present the phase 1 exploratory descriptive study to generate knowledge, and for that we can answer the first objective about to do more knowledge about these workers, no? And at the same time to prepare to generate information for the intervention, to model the intervention than we propose. No? There is 2 parts in this study: a qualitative exploratory study and descriptive study. It's a mixed method presentation. No? The objective of the qualitative study is to do a deep exploration about the work of the hotel housekeeper and the perception and opinions and experiences regarding their work, no? And in relation with the health problems. And additionally, we have another objective, is to have the opinions, to train to know, no, to know the barriers, the perceptions, all of the opinions, no, about an intervention. Do it with this group, no. And the descriptive study have several objectives. One of them is to know the exposures, no, the work-related risk factors and lifestyles. Second one, to know health determinants, social and family support and receive, locus of control, and health system accessibility. And to know too the chronic condition of these workers and what kind of treatment receive, and the consequences in quality of life, health services use, and sick leaves. For that, we designed this mixed method study, no, with exploratory qualitative study based in a phenomenological approach, and a descriptive study with a representative sample of hotel housekeeper of the Balearic Islands, and they are interviewed, and we use her clinical data. The setting is the 4 islands of the Balearic Island, no? And the primary healthcare centers are doing in primary healthcare centers. The inclusion criteria for the hotel housekeeper in both studies are to be older than 18 years, to have health coverage in the Balearic Island Public Health Service, had worked in the last season, no, in 28, in 2018, no? Had a valid telephone number to speak fluently in Spanish or Catalan, and signing a consent to be interviewed and to permit to authorize the access of clinical records, no? Was approved by the ethical committee. And the qualitative study has two parts, no? One part is 10 semi-structured interviews in first one with 4 hotel housekeepers, but leaders of unions, of association of hotel housekeepers. After that, we interviewed 3 management staff of the hotels and 3 doctors related with the problem of the hotel housekeepers, no? And we do also 6 focus group with hotels housekeeper. We involve 34 hotel housekeepers in these groups, are doing in different places. And what the focus group are stratified by age, the number of years working as a hotel housekeepers, the hotel rating, and the type of employment they have, no? We analyze that with the content analysis performance. Well, first of all, we transcribe the registers in videos and in audios registers, and we perform a content analysis with 2 researchers. And the result, we structured that in 4 axes, no? The hotel housekeeper work conditions, the perception regarding the employment status and conditions, perceptions about the health problems, and suggestion about the intervention. The hotel housekeeper characteristic and regulation, there's positive and negatives in the appreciation of the hotel housekeeper. They like the working schedules, no? The companionship, the relation with the clients, and the satisfaction with the well-done job, no? But in the other side, there are a very stressful job, physically very hard, with low value and poorly gratified with, and this is denounced by this kind of workers, no? At the same time, there is a lot of job strain, time pressure, working pace, and not predictable, and fluctuation in about the duties every day, no? But in positive, there is a safety condition of work and work-family balance permit to share the family task and her job. They perceive the health problems is due to the job, no? To the repetitive task, to use a lot of force to, for example, to move, to push the cleaning cart, no? Working with a very stressful rhythm, no? And that provoke back pain, cervical pain, whereas hand and knees are affected, no? Also, the time pressure and the low job flexibility provoke work stress and anxiety in this kind of workers, but the health professionals don't have the same perception, no? In this case, and they copy strategies that they use is self-medication or go to primary care to be attended by her family doctors in many cases, no? And about the opinion and suggestion for the intervention, they evaluate very well the positive attitude, have a positive attitude about physical activity groups, sessions, organize and participate in this kind of sessions. There is a group very stressed, and they prefer to have workshops to deal with better with the stress and the anxiety. Accept very well to have a physiotherapist service in primary healthcare to attend her problems, and for change the style of life are not very agree to do this kind of intervention in this program, no? To include that in the program. And the descriptive study, we study, first of all, we evaluate the exposures about the factor risk, physical, chemicals, psychosocial with the COPSOC questionnaire, no? The lifestyles, physical activity, diet, tobacco, health determinants, and health disorders, in this case to know the prevalence of different health problems that they have and the prevalence to take medication, no? And the consequences about the quality of life, health services use, and sick leaves, no? We do this descriptive study in 39 primary healthcare centers, no? We do a simple random sampling about the list of the people working as a hotel housekeeper. We include, our sample is 1,043 hotel housekeeper. The main age is 43 years, and the Spanish nationality is 54, and immigrants is about 20%. No? The job tenure is 10 years, and the majority working in 4-star hotels, and they do 18 rooms per day, and on average, and 44 rooms per day. But there is an important group that do more than 60 beds per day. It's very hard work in only 8 hours. No? And the results of COPSOC, that is a tool to identify risks for mental health, stress, and related to burnout and that. The first one is the workplace. The workplace is very unfavorable. No, there is a lot of quantitative demands. There is a role of conflicts and insecurity over working conditions. And the sense of justice is is the most marked as a unfavorable situation, and predictability. And in favorable situation is a role clarity, is very know that the meaning of work, the emotional demands, and vertical trust. But we can see the percentage is lower than that. Yes. They have social support and family functioning. It's okay in general, no, but the locus of control is internal in only a short part of this kind of workers. No, the quality of life, 30% smoke and have insufficient activity and not adherent, and the self-perception is really bad in comparison of the woman of the same age, of the woman working, of the woman in the same class. No? Okay. There is no problem in mobility, self-care, and usual activity, but there is a lot of pain. No? Only there is 33% that don't have pain in the day of the interviewed, no? And the punctuation in the base scale of Euroqual is 72, is lower than the same kind of women of the same age. Chronic pain for 3 months every day is very, very important. Back pain is the first, first hands, neck, and shoulders. 54% take analgesic every day. No, last year. No, and have prescribed analgesics and psychotropes in 18 and 30%, and the sick leave is for 1 year is 22.6. I'm finishing. The satisfaction with the GPs is very high. Is a place, and for that, and in conclusion, the hotel housekeeper perceive a very stressful job with a lot of musculoskeletal and pain disorders. No. The most frequent declared symptom is back pain, no, but followed by this and that, and also manifest a poor self-rated health perception, and 90% of them, they evaluate positively to do an intervention, and they have a lot, and they love to be implied in the design of this kind of intervention that we do in the next that start in next November, in 3 weeks, no? And that they can do the phase 3 in 2020.